Welcome back to Truth Hurts, where we expose corrupt politicians and lying corporate media. I'm Jake Duesenberg, your host, broadcasting live from Roseville, Minnesota, in the belly of the beast, the liberal zombie apocalypse of Minneapolis and St. Paul. For you guys that are watching live right now, I'm like a couple minutes delayed because I'm like, you know what? Before I even get into this show, which I don't have a definitive answer if Tim Walz is running for re-election. We're supposed to hear it by now, but we haven't heard anything. I'm like, I better just check like Twitter and make sure like the announcement didn't just come down, because this is like the most active guy I've seen who is like not ready to commit to running again and also raising money and stuff like that. My bet is still that he's probably not running, but I am not as sure of that as I was about a week ago. We'll get into all that. I got Mark Bishofsky coming on because one of the active things that Walz is doing is he's really fighting back against RFK Jr. and these terrible health policies, on COVID, the COVID vaccine, right? By the way, I'm not even so certain if I can say that without getting kicked off of the air. Has YouTube fully changed that? I don't know. We haven't tested it. We haven't been talking about it enough lately. But anyhow, and we got a comment that just dropped from Dr. Matt Klein, a senator in the state Senate. We got an update on who the Democrats elected. We got an update on the special session. There's so much to talk about. I'm going to try to fit it all in an hour, and then we'll do the post show for all of our premium subscribers. This episode is brought to you by Elton Coventry in the great city of St. Cloud, Minnesota. Also brought to you by EliteGuardianMN.com. If you need to get your concealed carry permit, we call them permit to carry in Minnesota, you can sign up at EliteGuardianMN.com, or you can go to, I'll just post it right here. Let's just do this. This is from the USCCA website. How do I do this again? I got to go to all, sign up here. If you're in the comments watching live, you can do it right there. We have a class coming up on October 6th. That's a Monday evening. So October 6th, Monday evening, you can sign up for it. Incognito in the comments, drop in and give me 20 for being late. Love it. Becky Heck says, hello, everyone. I say hello back to you. I saw Billy22 and Tucker in the comments before we got started here. Welcome to our audience coming in on YouTube and our audience on Facebook. Hopefully we're on Facebook. Let me just make sure before I get started, because I think this is going to be important stuff here. If you're living in Minnesota, for sure. All right, second. I'm just going to share this because I'm really excited. I haven't talked to Mark Bishofsky in a while. Live with Mark Bishofsky. Oops, it auto defaulted to love. Well, I mean, hey, who doesn't love Mark Bishofsky? All right, there we go. Got that shared. All right, perfect. We're on Facebook as well, and X. Let's break right into it. So, is Tim Walz going to run for re-election? Now, just if you don't know this, I mean, a lot of the people that watch the show every week, you understand that it's unprecedented in Minnesota for a person to run 3 terms, especially 3 consecutive terms. The last governor to do it, and it wasn't consecutive, is Tim Pawlenty. He took a break and then came back and ran in 2018 and got clobbered in the primary. So he didn't even make it to the general ballot. So it's very rare. It's not likely that these people run for 3 terms. I think it's kind of in like sync with the presidency. It wasn't until RFK, it wasn't until FDR ran for a 3rd and then a 4th term where anyone had run for president for more than 2 terms. It was kind of like this unspoken rule because George Washington only did 2 terms. And then we passed the 22nd Amendment, so now you can only run for 2 terms. LK to live. I'll take health advice from RFK Jr., who works out in denim over Walz and his chubby jazz hands. That is an interesting thing. What is with this new working out in jeans thing? Like, that is the weirdest trend I've ever seen. But the guy's definitely fit, no doubt about it. I actually believe that. Like, I am predisposed not to believe like any politician, and especially many in the Kennedy family. There's something about RFK that makes me believe a lot of what that guy says, or at least he's coming from a position where he's trying to be authentic. That's all I ask for, is just be authentic. Don't be one of these lying sacks of crap politicians. All right. So is Tim Walz running for re-election? I don't know. Let's take a look here. This is his. This is the most recent thing we have. Oops, I shared the wrong one. This is the most recent campaign finance that we have because obviously he is. Well, maybe most of you guys don't know this. They don't report disclosures um, on on non-election years. So you don't know until the end of the year. So all we have is what he had cash on hand at the end of 2024. Okay, I was sure it was showing up. Sorry, give me a second here. Okay, so at the end of 2024, he had $1 million cash on hand. There's many reports stating that Tim Walz has been raising money, so he's positioned. Now he went through about $9.5 million just his campaign alone. So that's not all the independent money outside of his campaign, which probably was tens of millions of dollars, at least $10 million. So this is just his campaign. He's already got $1 million as of January 1st of 2025. Okay, so let's assume he's raised hundreds of thousands, if not more than $1 million already this year, which he could give to another campaign. Right. In fact, it's really interesting. So if he decides not to run again, and Keith Ellison runs and gets a nod, or Steve Simon runs and gets a nod, Tim Walz can take the money from his campaign if he's closing it out and give it to one of those other campaigns. Now, let's say Joe Blowface gave Tim Walz the max donation. Okay, what is that? $4,000, something like that. He can also give Keith Ellison $4,000, and Tim Walz can, ipso facto, donate that money over to Keith Ellison. So, like, essentially doubling the donation of that one person. It's not like it's earmarked, but essentially that's kind of a way you could work around that system. So Tim Walz, even if he doesn't run, the fact that he's been fundraising, or the fact that he was sitting on $1 million cash in hand, I assume he hasn't burned through any of that, right? Has given him this great position for even if he doesn't run again, helping out whoever is going to run, because you would assume that's what he wants to do. And I think Tim Walz is motivated to stay relevant on the national scene, especially with the progressive left. Excuse me. Becky Heck says, yeah, I should have to report monthly. Yeah, unfortunately, they don't. You get a whole year, basically, of non-reporting. This is something I shared on the show when it came out, and I think it came out a while ago here. Give me a second. Sorry, I got to mess with this. 1 second, guys. This is what I missed Dawson for right here. Okay. Yep. I'm totally screwing this up. All right, I have to clear that screen because I want to share with you. There we go. Bear with me. Got it. All right, this is the Star Tribune, which did a poll back in, let's see here, June. So late June. It was the first time they had seen Tim Walz fall under 50% approval. Now, as crazy as that sounds, he peaked in May of 2020. I mean, listen, there were Republicans that were supporting Tim Walz in May of 2020, like Republicans at the Capitol, right? Eventually, it got ridiculous, and people started waking up to COVID. You could see the drop on Tim Walz. It looks like it did drop to 49% on September 2021, right as vaccine mandates were coming out nationally. Hit up a little bit, and then now he's down to 49% as of June of this year. Okay. So I remember what it was. He was at disapproval of 44%. This is the first time he had disapproval of over 50%. Or 50% or above. So in other words, there was a lot of people that just weren't sure. There's like 1% that aren't sure about Tim Walz today, like according to polls by the Star Tribune, which you don't really see that hardly ever. That's pretty crazy. But more importantly, even with a 49% approval rating, they asked to the respondents, should he run or should he step down, or are you not sure? And 45% of respondents said he should run. So in other words, 49% said should step down. So if he had 49% approval, he lost 4% who said, yeah, I like him, I approve of him, but he shouldn't run again. Which in my view is kind of like, well, he's kind of run his course, like he's a good guy. He was a good governor, but we need somebody new. And you can understand from like some people's perspective, there might be in the Keith Ellison camp or then the Steve Simon camp or God knows whose camp there. Maybe Peggy Flanagan decides, Angie Craig's really got the Senate thing locked up. I'm going to run for governor and just be as awful as can be, because she's got to be probably to the left of Tim Walz. There's like no distinction that I could see of her record. I mean, what do you mean by record too? Like lieutenant governors are just kind of yes men, but like no distinction I can see that gives me any belief that Peggy Flanagan would be any better. And there could be other candidates we don't even know. I mean, like, well, many people believe that that this is going to be a good year for Democrats 2026. I mean, generally speaking, it's not always this way. The party outside of the control of the White House picks up seats. And so does that bring another high-profile Democrat into wanting to run? So that's a big question. Anyhow, so we don't know, but the moves that he is making are really interesting. Like he is all over news, and we're talking about special sessions now. He wants to push gun control. And what just came about here recently, he's now issued a new executive order, which kind of brings out this like PTSD in me, like this, that's what he did during COVID. He was issuing executive orders, including the first one that he had, which was an executive order on declaring his own unilateral powers for emergencies, right? So this guy is making all the moves as if he was still going to run. Joining me as a guy that basically fought against Tim Walz side by side with me, really took the health freedom route, still this day is in health freedom, as the co-host of the Truth Expedition, my good friend Mark Bishofsky. How you doing there, Mark?
I'm doing pretty good. How you doing, Jake?
I'm doing okay, man. I am so glad you were able to do this. You were just taping for Truth Expedition. Who did you have on, and when can we expect this episode out?
It's already up. We did it live, and it should be available on Rumble. We had Ken McCarthy. He's the author of books such as What the Nurses Saw, which I was actually in that book. What I Saw During COVID. He's just completing a book called Diabolical Errors, which really goes into depth on the history of vaccines and the entire scam. Therein, he wrote JFK and RFK's secret battle against Zionist extremism. So we talked a lot about that. And since 24 years ago on Thursday was 9/11, we had a discussion about that as well. Ken's a wealth of knowledge.
Hey, by the way, before we get into this vaccine order by Tim Walz and get into all things COVID jabs, are you excited about this Tucker Carlson 9/11 documentary he's got coming out?
Yeah, and I need to watch him on Piers. Like apparently he just laid it all out. Said it was Israel.
He didn't quite say that. I just watched it.
From what I guess I didn't see it. I'm quoting Gunner. Said basically.
Oh, Gunner! Oh, fake news Gunner.
Basically,
he addressed
more or less came out and said it. I guess I need to watch it yet. I'm just a busy guy, and I can't find enough time to watch everything I want to watch.
Yeah, well, he did address it, and yeah, I was listening on the hike this morning. So, okay, so let's go into this. This is the new executive order from the guy that doesn't know if he's running again. I guess we're on his time now. Executive Order 2509, addressing continued vaccine access for Minnesotans. I, Tim Walz, Governor of the state of Minnesota, by the authority vested in the Constitution and applicable statute, issue the following executive order. Okay. We know how these things go. Vaccination, one of the greatest public health inventions of all time. Routine vaccination prevents hospital visits, disabilities, right? Okay, so we know that stuff. The Secretary of the United States Department of Health and Human Services, Robert F. Kennedy Jr., has led a misinformation campaign questioning the effectiveness and utility of vaccines. In the last few months, the federal government has systematically worked to eliminate scientific and medical expertise while simultaneously restricting authorization and access to certain critical vaccines. The result may well be a rise in devastating and preventable infectious disease like measles and polio. In response to these alarming moves by the federal government to limit the availability of and access to vaccines, we must act to ensure that Minnesotans know their access to vaccines remains secure. Okay, so he goes on to order the Minnesota Department of Health to collaborate and coordinate with the Minnesota Department of Human Services, Board of Pharmacy, and the Department of Commerce to continue to identify, review, and remove barriers to vaccine access to the fullest extent permitted by law and available funding so that vaccines remain broadly and readily accessible to Minnesotans. Direct the MDH director to review immunization recommendations and guidance on the COVID-19 vaccines, and, as appropriate, issue a standing order or protocol regarding access to COVID-19 vaccines no later than September 24th, 2025. A standing order or protocol should provide guidance to pharmacists and other healthcare providers on appropriate protocols for administering the vaccine to ensure the broadest possible access. Continue monitoring whether additional measures include use of standing orders may be necessary to provide clarity and guidance on other routine vaccines. Continue to provide guidance to the public, providers, payers, and pharmacists on vaccine safety, efficacy, and effectiveness, and provide updated guidance on the public on how and where to access vaccines while working to counteract the confusion and uncertainty caused by the federal government's new and continuing limitations on vaccine access-related misinformation. All right, Mark, because you and I live this here, I'm pulling up right now the order from Governor Walz on August 11th, 2021. For people that don't know and are from the state of Minnesota, Governor Walz basically had a mandate with the state workforce here on vaccination. So while Governor Walz sat by and watched Biden force private sector employees under Biden, or to see that mandate happen, he was active with the state workforce, okay, except for legislators, which have an exemption.
Right.
So in order to protect Minnesota workers and families from COVID-19 and prevent further spread of the virus and its highly contagious variants, Governor Tim Walz announced today that state agency employees will be required to show proof of vaccination or participate in regular testing before returning to the workplace. State agency employees working in person will be required to show proof of vaccination and attest to their vaccination status by Wednesday, September 8th. Employees who are not vaccinated will be required to receive a negative COVID-19 test at least once a week in order to work on site in all public workplaces around the state. Now, that makes sense if the vaccine stops you from getting COVID. Is that true? Did it stop people from getting COVID, Mark?
No,
Got it.
absolutely
Okay.
not.
It goes on to quote, vaccination is the best way to keep employees and people we serve safe and ensure the Delta variant does not derail our economic recovery. The state is leading by example and working to get our public employees vaccinated to protect themselves, their coworkers, and their communities with this action. We're joining businesses and colleges across the state who have taken this important step, and I urge other employers to do the same. Now, before I turn this over to you, Mark, because I know you got a million things to say, I just went in to get the most recent data here by the state of Minnesota. One thing that's really interesting, they brought the COVID vaccine data and they compiled it with the influenza, and the thing automatically just goes to influenza. I mean, it's like, yeah, you don't really want to talk about the COVID vaccine, right? So, by the way, I don't get the influenza. Well, it's not a vaccine; it's a shot, right? They're even changing the language, but I don't even get that thing. But here's the COVID-19. So you actually have to, if you want to go check this out yourself, you actually have to check the COVID-19. And this is the state of Minnesota. This is another interesting thing, Mark. You'd think they would have a different color coding, one that stands out more, but I think they want to blend it just because of how bad it is in the state of Minnesota.
Yeah.
Like dark blue would be 100% effectiveness. Sorry, meaning up to date on COVID-19. And just so you understand, and this is according to July of last year, what they mean by this is right here, people up to date on COVID-19 vaccinations. Means the number of people in Minnesota who have received the recommended dose of COVID-19 vaccine they are eligible to receive for ages 6 months through 4 years. Up to date means at least 2 doses of COVID-19 product, one which must be 2024-25 COVID-19 vaccine. And then for ages 5 up means 1 dose of the 2024-25 COVID-19 vaccine. Okay, so this is the data statewide, and as you can tell, it's the lightest of blue. We could just take, like, if you get past, well, let's do this. This is the metro, which has, if you get past up here in,
which is the highest county, Hennepin or Ramsey?
I think it was up here,
32.
Cook County, 32.5%.
Some liberals up there.
Well, it's basically no one. So it's Grand Marais, right? So Grand
Yeah.
Marais, which are a bunch of lefties. So yeah, I mean, if you get like Dakota's 23.6, Washington's 24.2%, Ramsey 27%, Hennepin's 28%. I mean, I don't know who these people are. Now you get up to like 9% up here in Marshall County. Polk County 10.7%. Like if you go down south, you're getting 9.8% in Noble. I mean, that's shockingly high too.
Yeah.
But I mean, you're looking at over time, a very low amount of people. Oh, look, see, defaulted back to influenza, right? And then by age group, sorry, let's see, it defaults to influenza. Don't want to be talking about those. So this is just like by total numbers in Minnesota from age 0 to 9, only 74,421.
Only though that is 74,000 kids put at risk for no reason.
Right. So this, I think, this is current on the website. This is the most current thing that we have. All right. I just threw a ton of things at you, Mark. You work in healthcare, both for Dr. Corey. You also are a respiratory therapist with a hospital. I mean, what do you think about Tim Walz's move here?
I don't think it changes much. I mean, it's not going to influence any of us or anyone that has a brain to go get these jabs. I think it probably does in the end make it gives a little more clarity for pharmacists, and probably will make it a little easier for these poor liberals to go get their children injected. And what I think about this whole thing, they just removed the COVID vaccines from the emergency use. They kind of like restricted some of them, but then the HHS rolled out these new Moderna and Pfizer jabs that they were accepted, but they withdrew the emergency use. So, and if they're not on the childhood vaccination schedule and they don't have emergency use, I'm now wondering, and I cannot find a definitive answer, if these pharmaceutical companies will now be liable for injuries, because it's only those vaccinations on the childhood vaccination schedule that are protected by the 1986 Childhood Vaccine Act. So there's a gray area there that these pharmaceutical companies could be put at huge risk of liability because we know people are getting injured. I mean, that was the first thing that came to mind with all this. With Walz don't you think what Walz just did is just kind of a show? Do you think it does anything? I mean,
well, that's my question. And okay, so this is Matt Klein. He's the one doctor he might be the one doctor now in the Senate. Certainly when Scott Jensen was there was a Republican. This is Dr. Klein talking about his wife going and being not able to get the COVID jab. This is 1 minute. Watch this. I mean, I find this hard to believe.
Hello, Minnesotans. Matt Klein here, running for Congress in Minnesota 2. Today I had an alarming experience, so it was good news that Governor Walz issued an executive order trying to protect access to vaccines. But on the same day, my wife went to Walgreens to get her flu shot and her COVID vaccine. They declined to give her a COVID vaccine. She offered to pay for it out of pocket. They said, no, we are not going to administer it. We're following CDC guidelines. When I say RFK Jr. is making us sicker, this is what I mean. My wife's trying to make a responsible decision so that she can stay healthy this winter and keep going to work, keep visiting her elderly mother, and she doesn't have access to a COVID vaccine at Walgreens. If it happened to her, it'll happen to thousands of others of Minnesotans. We're going to do something legislatively next session to make sure that people can obtain COVID vaccines.
Wait, hold on 1 second.
If it happened to her, it'll happen to thousands of others.
Thousands of others, yeah. Well, he's got the numbers right.
To make sure that people can obtain COVID vaccines.
So yeah, I mean, is this going to change? I mean, does Walz's executive order change this? I don't know really how it does. I don't understand how these pharmacies will now be like, oh, just shelling it out. I don't.
Yeah, and I also wonder. I mean, there's so many things that's going through my head here, but like, okay, so this is the doctor. Like, what is your wife fearful of COVID right now? Like, is anyone really fearful of COVID right now? I don't know these people. Maybe they are.
I've worked in 2 big hospitals, huge hospital systems. I have not seen anyone in intensive care or even on the medical surgical floors with COVID for well over a year and a half. People are not getting sick with COVID. You get the sniffles. It's a cold. It's become a cold. If it's anything at all.
Viruses are. They are colds, right?
Yeah.
So maybe they do have COVID, but it's just a different. It's like isn't this the pathway for viruses is to become less severe?
Yeah.
And right, so because otherwise, if you just kill your host, you die, right? So they're gonna come less severe. So isn't COVID just another cold?
It is. It's a coronavirus at this
So
point.
so we're vaccinating, and we're not vaccinating, right? Because they changed the definition of that. But we're supposedly vaccinating for this. And Dr. Klein's wife, it's so tragic. She can't get the vaccine. That doesn't even stop the spread of it. So what is the whole thing about grandma? Can't go see grandma or mom, I guess is what they said. Like, what is this? Like, literally, have these guys fallen asleep for like 4 or 5 years and still pushing the same damn propaganda?
They're going to push it for another decade. I don't get it. You know, I love to tell this. Let's just take a moment. I love to tell. So I looked at the Pfizer during the Delta variant, the original variant, when Pfizer was trialing this. They did 44,000 patients, 22,000 unvaccinated, 22,000 vaccinated. So correct me if I'm wrong, but 2 is 100% of 1, correct?
Yeah.
So there you go. So they had 22,000 unvaxxed, 22,000 vaxxed. In the vaccinated group, 1 person died of COVID. In the unvaccinated group, 2 people died.
Mm-hmm.
So that's your 100% effective.
Mm-hmm.
In other words, it took you have to vaccinate 22,000 people to save 1 life. But what's remarkable, the most remarkable thing of that whole study, which this is Pfizer's data, in the vaccinated group, there was a 23% increase in all-cause mortality in the vaccinated group.
Right.
So, and that's Pfizer's data.
Right.
How can they propagandize us and lie, you know, this bad to the public? I don't. And for people, these liberals, and you know, it's all mostly liberals. There's a few conservatives, I think, still getting it, and they're the elderly ones. Because I see who's vaccinated and who's not. It's by and large, you're over 70, and they just listen to their doctor.
Right.
Yeah.
Oh, okay. So, and I want to also emphasize one thing, and I don't think this is all about the money that's involved in it, but I did look up who lobbies for Pfizer, and I just looked at Pfizer. I mean, we're not talking about Moderna, Johnson & Johnson, but just looking at Pfizer, 3 lobbyists in the state of Minnesota, and definitely you can see them on Tim Walz's campaign finance report of 2022. I think it was like $1,500 in donations. So, like, there's that part of it too, that they are actually even compensated. I mean, we all hate the lobbyists putting money into politics, right? Don't we all hate it? That's not a conflict of interest. So he's also getting support from the pharmaceutical. By the way, that goes both sides too, right? Let's be honest about that. Republicans get that money too. But I do think, going back to what you were saying, I do think this is like some kind of crazy well, dare I say, left-wing conspiracy. This is the USA Today, because it's like, what is RFK Jr. really doing that have these guys so concerned, right? Like, the health is going to deteriorate, even though this vaccine is very ineffective. This is USA Today, so no right-wing piece. It says RFK Jr., the CDC, and confusing vaccine recommendations. What to know right now. Millions of dollars in cuts to vaccine technology, canceled research, mass resignations at the Center for Disease Control and Prevention, overhauled health councils, and ever-changing guidelines that result in sparring between government officials and professional media agencies. Keeping up with public health, and specifically who can get a COVID-19 vaccine, has become more of a challenge since HHS Secretary Robert Kennedy Jr. took office earlier this year. Kennedy ruffled feathers in health communities in June when he upended the advisory committee on immunization practices, replacing all 17 original members with new picks, some with a history of anti-vaccine advocacy. The committee provides guidance on vaccine use to the CDC. The disruption of the usual process for approving the updated fall vaccine has resulted in crunch where people looking for their seasonal shot suddenly are unaware if they can get them. And with cases on the rise, new Food and Drug Administration guidance handed down in late August still hasn't provided the concrete answers many were looking for. Here's what we know so far about your ability to access COVID-19 vaccine this year. Who is approved for COVID vaccine under FDA guidelines? Moderna, Pfizer, and Novavax. For those that are high risk and people over 65, Moderna vaccine was approved for children 6 months and older with an underlying condition and people over 65. Pfizer was approved for those 5 and older with an underlying condition and people over 65. And Novavax was approved for those 12 and older with an underlying condition and people over 65. Okay, so this is apparently what they're freaking out about. Now, I think you and I both would say, as bad as the vaccine is, if people want to make stupid choices with their own life, they have that right to do it, right?
Yeah, for sure. I'm all about free market. I as long as there's informed consent, go ahead, get 10 of them.
Okay. Now, with that being said, and this is quite a bit of an ask for a guy like you and me, can we just have honest fucking people in our government telling us the truth and the science? And obviously during COVID, that's not the case. That was not the case at all. They lied. They lied through their teeth. They told us it was safe and effective, and it wasn't safe and effective. VAERS data shows that very clearly. The skyrocketing of VAERS cases was, I mean, it can't be just some statistical anomaly. Like, that was crazy how many more VAERS reporting there was, which is probably underreported too, from my understanding. They told us that once you get it, you can't spread it. That was a lie. They also told us, well, once you're vaccinated, you don't need to wear a mask, which I'd argue no one needed to wear a mask because those are useless too. We got a Rumble Rant from Tucker 91. I guarantee that nobody at Walgreens has a medical license. Aren't they violating law when they give vaccines? They aren't doctors. Well, you can answer that.
I think the PrEP Act allowed them to give those vaccines, and the PrEP Act still stands. And that's where my question lies on the liability of them giving jabs to someone under 65 without an underlying condition. Is the PrEP Act what will protect them? But I can't find any clarity. I did hear, I think it was Aaron Siri say something about they better watch out for liability. So I think that's where the holdup is. And thank goodness, nobody should be taking that damn thing. If you ask me, nobody should take any vaccines, but I'm on the fringes there, but especially not the COVID vaccine. You got to be crazy.
Yeah. Do you even call it a vaccine? Do we just?
No, that I shouldn't. And I try to tell myself not to. It's gene therapy.
Yeah. Well, I mean, like a jab or a shot, because that's what it used to be. It was the flu shot, and then all of a sudden that's a vaccine, right? It's so interesting how they changed those definitions. No, that's fair, but it's like, I think the premise here by Walz and gang, because this is obviously not just him, is that, well, the government's recommendations are changing, and therefore the medical structure won't allow for a vaccine. So me, as the executor of the state of Minnesota, is going to weigh in on this thing, and hopefully they'll change it and just go, interesting. So what you guys are saying, somebody could get into power, centralized power, and put up an edict or major changes, and you don't like how that carries out to the lowest level? Interesting. Welcome to my ideology on governance 101. Like, maybe we have too much reliance on the federal government in the first place. Maybe we could agree on that, Tim Walz. I don't think so, by the way. I think it's all about the vaccine. It's all about, causing a storm. And RFK Jr., by the way, was a Democrat and probably kind of technically still is, right? Like, I don't know. Did he give up his card? I mean, as Democratic family as they come, the Kennedys. So, like, what a joke. And this issue used to be, I think, more mainstream in the Democrat side, which they've pretty much just abandoned this. They want to be authoritarian, medical, big pharma people.
Yeah, I think RFK is definitely a Democrat. When it comes to vaccines, he sides with us, but I think he's pro-choice. I think he's pro-green movement. I think he's anti-gun, all those things. So he's very much a Democrat. But as far, our grandparents' Democrat, not today's woke freaking men competing against women in tampons in boys' bathrooms Democrat,
Right.
He's a Democrat I could live with if I had, if you're going to have a Democrat in office, RFK versus Walz, who are you going to take? But I think when it comes to this executive order, I don't see any, and I skimmed through it, and I don't see anything about liability, and I don't think it's going to override this fear. I think this is why these pharmacies and doctors are going to, hesitate, because I think there is a liability now, a little bit of a risk. I think that's where they're unclear. If I give this jab and this person drops dead in 10 minutes, which happens, are they liable at that point?
So what do we know about the current strains of these jabs? Okay, I'm going to not say vaccine because it's not. So what do we know about that? I mean, obviously we had some terrible results from some of the initial strains of the I mean, it's all been updated, right? But the initial Pfizer, the initial Moderna, no doubt about it, right?
Right. It
Are people?
still codes for the spike so that you produce antibodies,
Mhm.
in spikes. So I don't see how it's going to be any safer. The spike protein, the lipid nanoparticles are still there. There's some computer code changes something within it to try to match a variant, but you can't keep up with these variants. There's
Right.
just no way. These jabs are never going to do anything for us other than harm us.
Right. Yeah. I mean, and they don't harm everybody, obviously, because it's still
No, they don't. It's a
somewhat
small.
rare.
Most people are fine. I think maybe
Right.
5%. And the
Luckily.
statistic, talking to Dr. Corey and Scott Marsland, we're 5% had some kind of adverse reaction. Far fewer than even 1% died. But when you got 270 million people took it, 1% of that's 2.7 million. I think we probably did have close to 1 million deaths, and the data shows that with excess deaths over the last several years. I mean, one year it was like 350,000 excess deaths above what would be expected when you compare it to like 2018, 2019. So, disabilities claims have skyrocketed. Cancer rates are skyrocketing. It's just, to me, like I said, the writing's on the wall if you have eyes and ears.
Gotcha. How much time do I have with you?
Maybe 10 more minutes.
Okay.
I'm already over my 15 I thought I had. Let's keep going.
Because it's rare that you and I get together these days, right?
I like it too. I mean, I'm sick of this computer. I've been on in front of it for like 2.5 hours, but I'm happy to keep going a while.
Yeah, I don't want to just continue picking your brain about it, just for people that don't know. So Mark and I fought, in the trenches, so to speak, during COVID. I think our paths crossed about a year into COVID when the vaccine mandates were coming out. You got real big, holding these rallies. We were pushing it. Obviously, we cut our teeth, like going up against the emergency powers, which is what gave Walz the power in the first place to do what he was doing. Actually, technically didn't, but he, courts go in this state. So you and I fought. We did some other politicking here for many years, and then you eventually abandoned Minnesota. You had a great opportunity. You're living kind of off the grid, so to speak.
Working my way there.
Life is good, right?
Yeah, I'm loving it.
All right. So we get less time. You used to be here in the studio often. You are working with Dr. Corey, as you alluded to. Can you talk a little bit about that? I'm sure he's going to appreciate the plug to our audience, but tell us a little bit about that.
Yeah, so it's Leading Edge Clinic, drpierrecorey.com. And, he started the clinic essentially treating people that were sick with COVID, acute COVID illness. And it just grew into then treating vaccine injuries. I think put about 3,000 vaccine injured we've helped like significantly. People that could no longer walk, disabled. I mean, these people got the shot. Within a week, they're in bed, trembling, shaking, can't think anymore. It obviously from the vaccine. The conventional system tells them it's all in their head. They come to us, they get fixed for the most part. Not everyone gets 100%. And then we treat long haul and branched out into adjunctive cancer care. So kind of an alternative cancer care using repurposed medications like ivermectin, mebendazole. Also now branched out to treating complex, what we just call complex medical. So anyone with a Parkinson's, multiple sclerosis, any kind of weird diseases, psoriasis, arthritis. You can go there for general medicine, pretty much everything, unless you get hit by a car or have crushing chest pain. The clinic can help, and it's unbelievable what I'm learning through them about different supplements, different remedies. I mean, in the scam, Dr. Corey is going to release a book. So he wrote The War on Ivermectin, which is a great read, really good. I mean, nonfiction can be dry. This isn't dry. He's coming out with another book here. It's going to drop in about a week about trace minerals and how that is causing so many illnesses because our soils are so depleted. And these different supplements you can take to offset this. And when you have a lack of trace minerals, then your body attracts heavy metals, which causes all these diseases. So, I mean, just Dr. Corey he's got so much integrity. I trust him 100%. He's not in it for the money. And then that guy took huge risk. He didn't know he was going to land on both feet. He's making way less than he was, but he can sleep at night. knowing he fought the system and blew the whistle, and he found his way to, a place where he could make some money and do the right thing. But yeah, I somehow found myself to working there. We're all remote. I get to work from home. So just grateful.
Well, I wish the whole system changed after COVID. Unfortunately, just little microcosms did, and that's good in my opinion, because I think there's definitely a market for that stuff. All right, Mark, so since I've got you here, and I'm just dying to discuss Epstein with you because we just don't get the time.
Careful.
Nope. You can go wherever you want to go with it, but I'm just going to say this because we have not spoken. And this came out, was this Friday or Thursday? Trump was an FBI informant in Epstein case, Speaker Johnson claims. You saw that headline, right?
Oh, yeah, and I posted on it, and I just got reamed, man, attacked by people. Oh, that's old news. I knew it was old news.
What do you mean it's old news? That was brand new. No one had ever talked about that. No one had
Well, no one, but apparently there was like these underlying murmurs of that he was helping the FBI back in the day.
Oh, God, what?
So it's like, okay, news, it's old news, whatever. But then it's a Democrat hoax. What the fuck are these people thinking? It's a Democrat hoax. How does that make any sense?
We'll put some more in the swear jar. I'm sorry. I dropped the F-bomb. So did Mark. That's what happens when we talk about
I wasn't gonna either, but when you know what? It's a Democrat hoax is the stupidest thing, I've ever heard. I've heard a lot of stupid things, but how can it be a Democrat hoax? How does that make any sense? So you have the world's most prolific child, sex trafficking guy that we know he did it, hundreds of girls. We know he had clients that are high profile. We know this is happening. All these flight logs, Gates, Clinton. How the Democrats just like created that whole storyline and it didn't happen. How does it make sense that it's a Democrat hoax? That is the stupid.
Well, I think he's, to give the devil his due here, not that Trump's the devil, but boy, he's exhibiting some really weird behavior lately, is that he's saying that the bringing this up and placing on him as the Democrat hoax, not that he's totally undermining the story, but I wanted to talk to you about this today, and then I saw it looks like Johnson says he didn't use the right terminology in calling Trump an Epstein informant. I haven't even read this yet, so we're gonna find out together because it looks like it even popped out yesterday afternoon. Speaker Mike Johnson on Monday revised his claim last week that President Donald Trump was an FBI informant in the Jeffrey Epstein case, telling reporters that he possibly didn't use the right terminology. What I was referring to in that long conversation was what the victim's attorney said more than a decade ago, Johnson said, adding that Trump kicked Epstein out of Mar-a-Lago and was generally helpful in law enforcement investigations of the convicted sex offender. I don't know if I use the right terminology, but that's the common knowledge and everybody knows that. So this is much to do about nothing, Johnson said. What? Well, what do you mean it's much to do about nothing? You said he was an FBI informant. Like all of a sudden we're all thinking, oh, which by the way, no one really, well, people believed it, unfortunately, but like most people are like, really, he's an FBI informant now? Like the story just keeps changing all day long and we're not finding out the truth, even though a lot of us kind of know the truth. We just don't, we haven't heard it through the official cables yet.
Right. You know what I think is let's see if I can remember, but there's three options here is what's going on. And I don't think option one is true. Trump's guilty of playing around with little girls. That's one thing the reason why he's doing this. I don't believe that. Could be, or he's protecting his buddies.
Yeah.
Or he knows the whole apparatus falls down if, which is kind of a protection thing too. That's why else would you hide this stuff? Why wouldn't you just be forthcoming? If you're not somehow involved or if there's not people you want to protect, why wouldn't you? You campaigned on releasing it in transparency. Why wouldn't you?
Right.
I don't see any other option.
So we supposedly have the birthday message sent to Trump. Have you looked at this? What are your thoughts on that?
I didn't. So Ryan Dawson, who's like, Ryan Dawson started researching Epstein in 2007. So he goes way back. He's the OG when it comes to Epstein research. He just posted on X a few hours ago a big thread on this birthday thing. And he says it's real. I need to look at that. I can't really comment on it too much, but we do know Trump in these.
This is from the Oversight Committee. And just FYI, I don't realize how busy I am until I realize I've seen the headlines and I actually haven't looked at. So you're looking at with me for the first time, but this is from the oversight. Well, okay, so I guess this is the Dems in the oversight committee. Here it is. We got Trump's birthday note to Jeffrey Epstein that the president said doesn't exist, which is fair point, by the way. Not that I'm buying what the Dems are bullshit, but it doesn't mean that they don't make points too. Trump talks about a wonderful secret the two of them shared. What is he hiding? Release the files. Now, we did know about the language here. This is voiceover. There must be more to life than having everything. Donald, yes, there is, but I won't tell you what it is. Jeffrey, nor will I, since I also know what it is. Donald, we have certain things in common, Jeffrey. Yes, we do, come to think of it. What's this say? Enigmas never age. Have you noticed that? As a matter of fact, it was clear to me the last time I saw you. A pal is a wonderful thing. Happy birthday, and may every day be another wonderful secret. Donald Trump.
Guess it doesn't really mean anything, doesn't prove anything.
Well, it proves
they were close.
At least the oversight committee released it in the recent drop.
I mean, they were pals.
Something that was voted against by a lot of establishment types. I think James Comer wasn't happy that they had to do that. They actually had to go to the Department of Justice, and say, you have to release these files to us. Like, they didn't want to do that. Their whole thing was, well, we're going to let the DOJ release things on their own pace, which no one should trust the DOJ. You've seen also, God, there's so many things to talk about with you, Mark. You've seen that this the oversight committee got that missing minute that supposedly doesn't exist. That Pam Bondi herself said, well, it's due to this like lapse at midnight. And then apparently it's not, because that minute does exist. So it means that somebody took out a minute of the video and security video, which, by the way, did he kill himself in jail or not? Like, once again, you want us distracted and looking at that. Not that it's not important. It's just that that's not as important as who are the beneficiaries of the trafficked girls and who did he work for? Israel. We know those things, right? That's the things that are important, but they don't even get that right, and they lie about that. It's like the lies all over the place on this damn thing, and then we're just told it's a Democrat hoax.
Yeah, and I forgot the other option about what Trump might be doing, and this is what the Q people or the trust the plan people think, and it's possible that he's withholding it until they get all their ducks in a row, kind of a thing. Because with any crime investigation, you don't want to release all the evidence, because then everyone can come out and say, yeah, I was in a room that had this kind of bed and blanket too, because that's the whole thing. There's court documents, there's flight logs. It's not just the flight logs. There's court documents, there's testimonies. And so if you give all this information, then anyone can come out and say a Me Too kind of a thing. Like, I was in that hotel room too with that statue and all, with that person. So there is a reason to withhold some of this. But only if you feel like there are more people to go after. I mean, so I guess there would be. I mean, does that make sense? I mean, there is a reason.
It makes sense, but then why lie about this stuff? And this is the problem that I have is when you lie to me, and this is the thing that hurts me with Trump. Like, I can't get past the fact that you just like straight up lie about this stuff, right?
Yeah, I mean, if what I was saying was the case, what would be his reasoning to not just say that? We're waiting.
Yeah, we're building the case. There'll be something important. Like,
right.
You're right. The Q people go, trust the plan. There'll be rest. They'll be going to Gitmo Bay. It's like, well, why doesn't Trump say, listen, we are working on the investigation. There'll be a big thing to come. By the way, that's kind of what Pam Bondi was saying. Oh, we're going to be releasing files. And then the rollout that they had to social media influencers, the whole thing is just bullshit. And so that's why I can't believe that stuff. And that's why I can't believe any of these guys anymore. And the problem is I can't believe any policy decisions, and it's not just this, Mark. It's like, well, Republicans are in charge of Congress, and where's the budget? Where's the 12 independent budget bills, right? No, you're going to do a continuing resolution and kick the can down the road again, even though you're in charge of Congress and the presidency, right? And where's Doge cuts? Doge cuts aren't happening, right? You increase the Department of Defense budget to $1 trillion. Like, oh, that's saving our national debt. The deficit is expanding. I hear people say, and I should break this down in the show some point, oh, we're collecting all this money from tariffs. Yeah, we are collecting more money from tariffs, but guess what? It's not actually making a dent on the budget deficit.
Like, no, it's not coming back to us.
And it's not coming back to us. Good point.
We're paying it.
Right. Well, the reason that we have inflated prices at the grocery store and everywhere else is because we have an unaffordable government. What are Republicans doing about the unaffordable government? Because if you have an unaffordable government, you have unaffordable life for the people. And this is where Republicans, and I'm going to say this over and over again because I'm going to call it here before the midterms and before 2028, Republicans will be viewed as failures if they don't solve this issue. And the only way to solve this issue is you got to say, we can't afford this government anymore, guys. I'm sorry. You love this bloated government. It's $2 trillion overspending every year, and that's being financed by the Federal Reserve. We can't do this anymore. We have to balance the budget, and actually we have to start paying down that debt. They're not going to do that. Trump doesn't seem willing to do it. And so prices will continue to rise, and life will become more affordable. And right now the mean of our average home age of first-time buyers of homes, so I said that a weird way, first-time average home
age of an average home buyer right now is increased.
38. Yeah, it's 38 years old. When's it going to be?
You can't afford
in a couple of years.
Like this whole. You're right. As far as presidents go, Trump probably is the greatest president we've had. I don't know, Reagan.
In modern time, yeah, sure.
But he's still not doing what it takes to save us by any means. The big beautiful bill, the deficit, the debt. All these things. I mean, he's not doing really, in my opinion, anything really tangible to save this republic from a collapse. The financial.
Well, he's definitely stopping a southern invasion on our border, which is not a small issue. So that's
that's what I mean. So and that is tangible, I guess.
And the other thing is, and I was just listening to, as I was talking about Tucker on Piers Morgan. I'm sorry, I'm overtime with you, Mark, but God, I miss talking to you about this stuff. Keith Starmer is failing tremendously on protecting free speech in Great Britain. I mean, they're literally like jailing comedians.
Simply, you just say something about a tranny and you go to jail.
Right, but we know that was where Tim Walz and Kamala Harris were going, right? That's the thing about Trump. I mean, now, if you speak out about Israel on college campuses, that's a different story. But for the most part, Trump is doing a pretty good job not going after the First Amendment. That was a massive threat. So those two things I think are pretty big.
But I think it's coming because
yeah, fair.
In fact, I'm hosting another show. So the Leading Edge Clinics podcast, I'm hosting that show now too. So we had Twyla on, Twyla Braze very well. And we discussed this new digital health ecosystem, how it relates to HIPAA and the Real ID and all this stuff. And it's a surveillance system. There's no two ways about it. It's about collecting your data and surveilling you, knowing as much as they can about you. This HIPAA has nothing to do with your privacy. It's all about spreading your data and sharing your data. And if you look at the previous administration, they caused this chaos, crime went up, the border was open, all this crazy draconian stuff. And now you have the right wing. Trump comes in to save the day. And now conservatives are kind of welcoming martial law, and we're welcoming Palantir and surveillance and all this shit. To me, it's like, are they just playing off each other and just growing this and working for the globalists or whoever's in control of this? Maybe I sound crazy. I don't know what's happening.
The uniparty exists, and we've known and we talked about it.
And so is Trump part of that uniparty?
It seems like that, or they got some goods on them. Either way, it doesn't seem like he's not killing the deep state. That's what I used to say about his first term. It's like, he went there to drain the swamp, and the last bill he signed, it was just awful omnibus bill that he signed. I'm like, well, that was the biggest swamp bill I've ever seen. So clearly you failed. And he failed so tremendously at draining the swamp that literally his own intelligence agencies framed him, right? Well, they framed him on Russia, but then they framed him as, well, this story on Hunter Biden is Russian disinformation. So they basically threw the election for him. You didn't drain the swamp.
No,
you didn't. And I don't know. I don't know if he could.
You're just not trusting the plan. You just got to wait.
Yeah.
I think it'll be November 6th, 2028. That's when he drops the bomb and saves everything. When's he going to do this to you folks that are trusting the plan? At what point? He's at almost 5 years. I mean, he's done some good things, but he has to do some good things.
Yeah.
Otherwise, we'd all go crazy. He's doing just enough to pacify us, in my mind.
Yeah, and no doubt better than obviously Kamala Harris. I'm not trying to make that argument. But there was an argument for Kamala Harris, if the nation's going to fail, let it be our enemy at the helm instead of, supposedly our guy. So, all right, Mark, thank you so much for giving me all the time today. That was awesome. We got to go into some of this stuff in more depth. I know I see the hate you get on Facebook. I'm maybe not as vocal on it, but you see what happens when I post. especially on Iran.
I try to get there and back you up when I see them. I'm trying to stay away from
I
it.
do not
actually.
care. I don't
so
care.
Toxic. I post and I let people comment every once in a while. I'll put a laugh emoji, like whatever. Think what you want.
Well, the nice thing about our audience really sees this stuff and they get it. So it's like we didn't build this audience. I just, Republican cheerleaders, right? People understand the Republicans are just as much the problem as the Democrats. Now, the thing that's nice is Republicans have patriots and they offer solutions. The Democrats don't, right?
Yep.
They'll kick the
We're on the right
RFKs
side.
out.
We're
Right.
on the right side.
All right. Thanks very much, Mark. For all of our premium insiders, we'll go into a post show here. Much more vocal with this group. We'll read all the comments here. I'm going to post the link. If you want to be a premium insider, I'm going to type this, become a premium insider right here. There's the link. You can do that. That's such a cool thing. We're going to do way more shows from the premium insiders in the immediate term as MAGA Jesse determines where he's going, what he wants to do, dying to get something's got to get to his heart on what he wants to talk about. I think he's been a little more exhausted on politics recently, which is fair. We all get that way, but the show must go on. So in the media time, we're probably still not going to do Tuesdays and Thursdays, but premium insiders get stuff all the time, which is easy because I can just go live wherever I'm at, actually, which is really cool. And we'll get you inside info. I'm going to talk to you guys about the Democrats' new pick as leader in Minnesota. This guy's a real treat. And what's going on with a special session. Join me in the post show. Thank you to our sponsors, Day Alpine Chemistry in St. Cloud, Minnesota. And thank you to Elite Guardian. If you are in need of renewing or getting your permit to carry in Minnesota, you can go to eliteguardianmn.com. There's an Monday, October 6th class. Sign up for it. I'd love to have you there. All right. Everyone, we'll see you soon. And for our subscribers, I'll see you in the post show.